Hello, I'm Dr. Panna Muqit. I'm a GP and I see lots of patients in my surgery with MS, so I know how difficult it can be to come and see your GP with sometimes embarrassing symptoms related to your MS. So here are my top tips for how to speak to your GP about these difficult symptoms. Tip 1, write it down. I think it's very important to make a list. Don't be afraid to write things down. It's actually really helpful for us to see a list as well. And actually being aware that your GP maybe has 10 minutes with you would then allow you to prioritize maybe the symptoms that you see are the most important to you. And hopefully they will be then dealt with first. Tip 2 would be to get ahead of the game. It's helpful if you can maybe give your healthcare professional an indication of why it is that you are wanting to see them or the symptoms that you're wanting to discuss. In our surgery, for example, there is a way of sending an electronic message through. But of course, not all practices or not all healthcare professionals may have access in this way. So just to keep that in mind, but if it is possible, it just allows your healthcare professional to be prepared for some of the questions that may be coming their way. Tip 3, strengthen numbers. If it's helpful, bring along a partner or a friend who can be your pair of listening ears. Sometimes when you're in a consultation and it's already a little bit embarrassing or difficult to begin with, it can be difficult taking in the information that's given to you. So if you've got somebody who can make a note of things that are said, you can have a chat about it afterwards, and hopefully that will reduce some of the communication difficulties that can arise from not being able to take in the information during your consultation. Tip 4, your GP is just the start. GPs work as part of a bigger team with other specialists. So if there's a problem that perhaps your GP can't directly deal with, they may need to speak to your neurologist, or they may need to speak to the MS nurse. There are incontinence nurses or a gastroenterologist if it's a bowel-related problem, or it may be a counsellor or a clinical psychologist if there's a mental health issue. And remember, you have a say in your healthcare, so you should play a part in discussions and coming up with a solution for the problems that you've presented with. Tip 5, find the right GP. There may be other GPs working at the practice that you're registered at, and so it'd be important to find a doctor who you're able to be open and most comfortable with about the symptoms that you're coming in to speak about. So don't be afraid to ask. And don't forget to mention MS at your appointment, because sometimes that may become lost in your notes, and it would be important to mention that right at the beginning. Finally, remember, MS charities are there to help. Don't forget to check out their websites for more support and information. Remember, you're not alone. Visit our website to find out more about difficult MS symptoms.